McDonald's, but I want the cheese curds from Culver's, and then I want some ice cream. So they come back to back to back. When the weight comes on us, like the midlife weight, it's not just weight filling you out. It's the weight in the midsection. That's hormonal weight. And when that weight sits, that's up close to your heart. So women, one of the number one causes of death is heart disease. I've talked to so many older women who have told me that going through a hormonal imbalance will test your marriage. Women should have no shame in trying to get something to help them with the weight.
I told him I'm losing way too much weight. It's working too well. Please, can we get away from that?
MenoTheSis, her heartbeat is the power of the world. MenoTheSis.
Today's episode of MenoTheSis is proudly sponsored by Beating Heart Health for Women Foundation. Ladies, save the date. Join us for the 2026 inaugural Menopause Summit on Saturday, October 3rd, 2026, from 11 a.m. to 3 p.m. at the Apopka Community Center in Apopka, Florida. This empowering event is designed to educate, inspire, and connect women navigating perimenopause, menopause, and beyond. Attendees will hear from a panel of experts, including a board-certified gynecologist, a clinical pharmacist, a licensed mental health therapist, and a nutrition specialist, all sharing practical information to help women advocate for their health and thrive through all stages of life. Vendor and sponsorship opportunities are available, but spaces are very limited. Visit bhforwomen.org for event updates, sponsorship information, vendor registration, and upcoming announcements. And be sure to follow Beating Heart Health for Women on social media. Because when women are informed, empowered, and supported, the pause truly becomes their power. See you at the summit.
Hey girls, hey! Welcome back to MenoTheSis. I am your host, Dr. LaShonda Bailey.
And I'm your co-host, Veronica Mcdowall. Hi.
And today, the title of this episode is The Weight of It All, Menopause, Weight Gain, and Body Image. Now, today we're talking about this because so many women experience this silently, but don't always talk about it openly. It's the weight of it all.
And not just physical weight. Nope, but emotional weight, hormonal weight, the frustration, the body changes, the identity shifts, and how menopause can completely change your relationship with your body.
Yep. So what's so interesting about this episode, V, it was literally my dissertation in real time. When I first started this doctoral journey, my original focus was actually centered around GLP-1 medications and pharmacological support for bariatric surgery patients. That's me, who experience weight gain. So because I've had a gastric bypass surgery in 2008, I understood firsthand how emotional and complex weight gain could be and how it could feel when the scales started tipping. But then my body started changing, and then the menopause symptoms started worsening, and it just kind of overtook my body. The weight gain increased. I had emotional shifts up and down, and suddenly the whole dissertation that I was set to write evolved as I was evolving. So that's how I ended up researching and writing, exploring the emotional perceptions of weight gain in menopausal women post-bariatric surgery, because it got to the point where I was so emotional when my hormones was going all over the place till it was like, okay, forget that first topic. This right here is like, what is wrong with me? Because I was like a crazy woman all over the place.
It was more real.
So
Yeah.
then that's why I switched, because I felt like nobody really talk about how women, we get emotional when we're sick,
Yep.
emotional when we don't feel good.
Yep.
And now you having a hormonal transition in your whole body. And I'm like, wait, what?
Yeah.
Because I wasn't even thinking when I hear menopause that people actually, or women, their whole identity shift.
Yeah. I agree with you on that one. I wouldn't have expected that at all.
I wouldn't have expected that. So because I wasn't studying data anymore, I was living the data. So I was my own data. And I'm like, what is happening?
Well, that's the beauty and that's the reason for this podcast.
Yeah.
It's real stories, it's real women telling the reality of what actually happens to us
Yeah.
all. And that's what makes this conversation so powerful, because it's not a theory, it's real life.
Yes. Because real life, I gained 20 to 25 pounds within like 6 months. That's a lot of weight. I felt heavy. I was uncomfortable. We have a 2-story house. Walking upstairs, I was winded, out of breath. It's like you feel it in your body, not only
Right.
just your clothes, but your fatigue. You feel
Mhm.
sluggish. I mean, I did not feel like myself, and I was struggling.
I'm so sorry.
Yeah, well, I'm better now, but that's what I was going through, and a lot of women are still right there going through it, suffering silently.
Because they haven't, you know, let me see. In your case, you were in the middle of writing your dissertation. So looking for topics and what was, real, what was going to hit you, what was going to make you,
Right. Yes.
So that's why it stood out and led to you to go deeper into the research. Most women, they're just like, oh God, when is this going to go get over with?
That's what I'm saying.
Like,
If I got to write about something, I might as well help myself in the process,
Very true. Very
because
true.
the whole process is arduous and it's very convoluted. I was like, you know what? I am going to help myself, and I'm going to help some other women,
There you go.
because you spend a lot of time researching, reading articles. Why not read and research and start finding treatment so I can start feeling better for myself?
Yeah, that's
And
that's
then
that's the beauty of it.
get
And
this-
look,
look what happened. Now I'm
Yes.
doctor.
okay,
Done.
LaShonda Bailey.
Dissertation. done.
Okay, and the movement has begun.
Come on, move with us, ladies, because it's done. I mean, I'm tired of the whole menopause is a taboo. People don't really talk about it. It's just like suffering in silence to hormone replacement therapy or not. That's the
Mhm.
question. And it's like, do some research, educate yourself, and find out what works for you. Because if you have a headache, you're going to take a Tylenol, right?
That's right.
So if you have a hormonal imbalance,
Mhm.
then why not look into taking some type of medication that's going to help you balance yourself out and feel better about yourself?
Very true.
Even if it's not the traditional approach, some women want to do it holistically.
And
Do a
that's
little bit
fine.
of research and find out for yourself. Talk to your doctor, because medicine improves every day. Some data may be outdated data, taboo data that doesn't pertain to you or
Right.
your ethnicity or
That.
race.
That.
So go deeper and find
Mhm.
out exactly what is meant for you and what treatment may work for you.
When it comes to menopause, one size fits all. That's not a thing.
That's not a thing anymore.
No,
That is
at
not
all.
a thing anymore. You're right. I
Yeah.
wanted my life back.
There you go.
I wanted to feel comfortable in my own skin. I wanted energy. I wanted balance. And honey, I wanted to breathe. I wanted to be able to breathe, not be winded, just walking to my car or, that.
Especially when you already went through the bariatric surgery. You understand? You already went through that. You got
I
what
had
you
that.
wanted
That's
to
why I
do.
had surgery.
You
Because
understand?
I was out of breath.
This is what I'm saying.
Yes.
So it's like, wait, hold on.
Right.
Hold on.
Right.
Why are we going through this again?
Why menopause gonna
You
make me go through
understand? Like,
this?
this ain't okay.
Yes, this is. You are correct. You are correct. You are correct,
And you
Veronica.
like, but you know my thing. It's not fair. Let us say it's not fair because it ain't fair.
Well, you know what my saying is. I'd
Mhm.
rather have a period for the rest of my life.
Well, you
Okay,
know how I feel about
Okay,
that.
sister, go
It's
on
fine.
ahead, sis.
All right.
Because I milk that soapbox all day long.
Okay. So let's bring it back and let's talk more about the GLP-1, right?
Okay.
And your journey specifically with that, because a lot of women right now in this world, that's a thing. It's
Yes.
like it's like the new hype. You understand? So let's talk about your journey itself with that.
Well, what I will say is I don't think it's women should have no shame in
Mhm.
trying to get something to help them with the weight. There is no shame in getting a GLP-1 medication. And most times, if you are going through bariatric surgery
Mhm.
or you have regained some weight, when you go to your bariatric doctor for your follow up or checkup, they will speak to you openly about the possibility of getting on a GLP-1 to help you get back down to your comfort
Oh,
weight or your desired weight.
okay.
So it is something that is not hush hush in the bariatric realm.
Right.
A doctor will recommend that for you. When you're waiting for surgery, some patients get on a GLP-1 to help them get down to that comfortable weight they need to qualify for surgery before you have your weight loss surgery. So for me, when I gained the weight,
Mhm.
one of the things I spoke to my doctor about was GLP-1s, and he recommended Manjaro.
Okay.
And the reason why he recommended Manjaro is because of my past surgery. Your absorption
Mhm.
changes, your nutrition changes when you have a gastric bypass. So he said, you'll do better with Manjaro.
Okay.
The caveat to that is I did not have the diagnosis to
Mhm.
qualify for Manjaro, so the insurance will pay for it.
Right.
I was insulin resistant before a gastric bypass,
Oh,
but gastric cured that. So
right.
now I don't have anything like diabetes,
Mhm.
insulin resistant that will qualify for me to have Manjaro.
Right.
So I pay for it out of pocket.
Oh, yeah.
Yes. So
And that's
we
one of the more expensive ones.
that's one of the more expensive ones.
Mhm.
So we budgeted out
Mhm.
and I said, you know what? And I'm going to do this for myself
Right.
because I didn't feel good in my own skin. I had gained weight. I'm going through the things. Part of the emotional wave was I was spazzing out because I was heavy. I was
Mhm.
spazzing out because I was fatigued. I didn't feel good. So the first thing I'm like, I need to lose this weight. Majero was not covered. So it cost me about $450 a month
Oof.
out of pocket. I budget to be on it for 6 months to see
Mhm.
what would happen. Let me just lose, this what, not just, it wasn't a small amount of weight. So I'm not going to just say it loosely, this little.
Right.
No, it was about 50, 60 pounds
Oh,
that I felt like that's a considerable amount of weight.
yes, it is.
I
Mhm.
needed to drop because I needed to get back down to my comfort weight.
Right.
So even before the 20 to 25 pounds for menopause, I still had gained weight. So let's
Mm.
just bring me back down to my comfort so
Mhm.
I can start to feel better. What I found was I was on it for about 3 months and the weight was moving very, very slowly. I think in 3 months I lost maybe about 8 to 10 pounds and
Okay.
it's costing me $450 a month.
Right.
Then the drug got so popular
Yeah.
that the surplus,
Yes.
you couldn't find it. And
Mhm.
then there were actual patients that are diabetic that needed this medication.
Mhm.
So I started to feel like, I'm going to remove myself from the equation. The people who need it, who has that diagnosis,
Right.
they need that medication. So I did it for 3 months. I was like, and then within the 3 months, the price went up.
Yeah.
Price went up to $550.
Yeah.
So I was like, okay, is this something that I can keep, afford to continue?
Right.
So with that, I started researching. 'Cause you know me, I will
Mhm.
scour the internet, the Google Scholar to find out what I needed to do. And then that's when I started reading about gastric revision.
Oh.
I didn't even know I could get my weight loss surgery, my bariatric surgery revised, and I did. So I
Okay.
spoke to my doctor about it. We went through the process, and my insurance covered it.
Oh, that's good. Yeah.
So that was the start of me educating myself because I wanted to feel better. So I didn't even know I could revise my surgery. I had surgery about 16, 17 years ago. I
Right.
did not know that was an option for me. And then
That's
it's
good.
covered under my insurance,
Right. Which is good.
which is good. So that was my experience with the drug. I know a lot of women have problems getting the drug because it's so costly. They don't qualify for it, which is a sad thing. But I know you took GLP-1s as well.
Yes.
So what was your experience like with it? And did you have any of those issues with that I did not qualifying for it to cover?
Initially, I didn't qualify.
You did not.
Yes, initially I didn't qualify for it. But then I was diagnosed due to my other ailments.
Mm-hmm.
I was taking a lot of steroids and
Mhm.
getting a lot of steroid injections, and steroid medication. So then I was diagnosed with steroid-induced diabetes.
Whoa. So that was the diagnosis.
Yes. And
I'm
I gained a lot of weight
sorry.
overall. It's all right.
Yeah.
Still dealing with it, but it's all right.
Yeah.
I gained a lot of weight overall.
Yeah.
Um,
Steroids, that's a side effect. Make you gain
yes.
weight. Yep.
So the doctor was like, okay, well, you are diabetic now at this point. Like your numbers
Oh,
are high.
wow.
Let's go ahead and put you on. The first one we tried was Govi.
Mm-hmm. How was that?
Not good.
Why? Did you have any side effects?
Not really no side effects. It's just nothing was happening.
Oh,
And
no, weight was moving.
no.
Yeah.
And then my concern was more so, is it because I am still on steroids? Because we're still working on the other issues. So I'm still getting steroid injections and taking
Okay.
steroid medication. So it's one is countering the other. So you
Okay.
need something a little bit more effective, more strong. And then the doctor was like, let me put you on Monjero. So I said, okay, cool. Let's try this. And I would say overall on Monjero, I did lose over 70 pounds.
Yes, you did.
And it actually, the only side effect I really had was, let's say, a little bit of nausea.
Mhm.
But I would always tell myself, I'm not even sure if it was the Monjero giving me the nausea or it was the other medication I'm taking. So I would just tell her I'm always nauseous. I don't even know what's making me nauseous. I'm just always nauseous.
Is it because you take so many medications, you
And
don't know
yes,
which one, right?
exactly.
Yeah.
So I don't know which one at all. So, and I actually still take Monjero. So I take it now actually to maintain
Okay.
my weight and to maintain my levels because I am still
Diabetic.
diabetic and I
Yeah.
am still taking steroid. I might not be doing steroid injections, but I do take steroid medication for my rheumatoid arthritis.
Oh, okay.
So I still have to make sure I keep everything leveled out. I actually just went to see my doctor on Tuesday or
Mhm.
Monday. I can't remember.
It's
One
the
of these
menopause.
days.
Well,
Yeah,
yeah, your
my
brain.
brain is
Yeah.
bugging out these days.
Yes.
Brain
Yes.
fog. But
Mhm. Yeah.
me and him were talking, and I was like, "Hey, I know we brought it down to 5, right?
Mhm.
5 milligrams." And I was like, "Can we raise it up? Because I feel like you have me on 5, and I'm putting on like pounds, right? So it's
So you're up
yes,
to 10 milligrams?
no, oh no, I'm not. I was on 10, and I was actually on 10 for several months.
Oh,
And
okay.
I told him I'm losing way too much weight. It's working too well. Please,
Wow.
can we get away from that?
You hear that, ladies? She's losing too much weight.
Yes, I had a goal weight. I hit the goal weight. I'm going way beyond the goal weight, and
Oh,
I was
yeah.
like, "We need to stop. Like,
Yeah.
can we
'Cause you
stop?"
still wanna look healthy.
Right.
Yeah.
So, and then I was like, then we were doing it, taking it once a month. I
Mhm.
would take the injection, but then after I was like, "Can we just bring it down?"
Yeah.
So we brought me back down to 5,
So
and I've
5
just
is
been
comfortable for you.
right.
Okay.
Well, I thought so, but then I'm adding pounds, and I'm not sure. So here's my conflict, right?
Mhm.
Yes, I am still taking the steroid medication for the RA, right?
Mhm.
But I also know that I am in perimenopause, right? And between, that
Mhm.
can cause
Mhm.
weight gain. I am having certain, I won't even say cravings or just a lot of stuff is just changing
Is it the
overall.
emotional eating?
I want to say it is emotional.
Yeah.
It is definitely
Yeah.
emotional eating
Yeah.
because most of the times I just be finding like, okay,
Yes,
you know
I
what?
emotionally eat too.
Yeah, it is that.
I have spurts of that too.
It's rough because Uber
Yes, it
Eats.
is. Yes, it is.
Whew, my
Yes, it
husband
is.
hates to see me pull out that phone.
Listen,
What are you doing now? Why is it? And then the doorbell will ring. It's so funny because the doorbell will ring
what is
because
it, DoorDash?
yes, and it's coming from 3 different places, 3 different restaurants.
So is
Because I want the French fries from McDonald's, right? But I want the cheese curds from Culver's.
What?
And then I want some ice cream, right? But I'm not sure. So sometimes I go back and forth if I want Cold Stone or I want Dairy Queen. So they come back to back to back. Let me tell you something. So it's literally, and I had to tell myself, and I spoke to my therapist about it.
Yeah.
And
That's
she
a
was
good
like,
start.
Veronica, you got, when you feel like that, drink some water, like just remind yourself you're not hungry.
Right.
And so I'm talking to my doctor and I was like, okay, listen, Drew. Okay.
First name?
Yes. Drew, this, something can we push it up?
Yeah.
And can we do that to like help me out? I said, because one, they're increasing my steroids now.
Yeah.
You understand? They're like, because like I said, there's a lot going on.
Mm-hmm.
So they're increasing the amount of steroids that I have to take that I wasn't taking before. And I'm trying to regulate my emotions.
Yep.
I am trying to stay calm. I'm trying to get this menopause period of life in order. So I was like, I need a little bit more help. My numbers are getting higher. My A1C rate is getting higher. So it's like, all right, we need to do a little bit more.
Yeah.
You understand? Yes.
Yeah.
So I did have it raised to 7.5. And my insurance covers it all because I am
Wow.
diabetic, and then I just take it.
I would say, in fact, that you are very blessed because I know how insurance works and I know how difficult it is for some people who really need the help of the
Yeah.
GLP-1s and they're being denied.
Listen, and it's always out of stock, even for me.
Oh my gosh.
Even
Is
for
that
me.
still the issue?
Yes, please. Even when he increased it to the 7.5, I had to wait 3 days before they can get it to me.
Yeah.
You understand? Like it's always out of stock, and then they'll just tell me, "Hey, we placed the order. We're just gonna
So
wait
it's
for
like
it
my
to come back."
patch.
Yes,
Give her a damn shot.
because I need it.
Remember you
I need it. Okay,
She need a shot.
thank you.
Yes.
I need to, and that's the thing. I was like, I like to stay with the GLP-1s. You want to stay on a set schedule.
Yeah.
But unfortunately, how popular everything is, you cannot stay on a set schedule.
Yeah. I don't think it's any shame with needing any additional help. I don't think it's any shame in if you qualify for those medications, you have the diagnosis and your insurance covers it. It's something to help you because so many women are suffering with that extra weight. And when the weight comes on us, like the midlife weight, it's not just weight filling you out.
No.
It's the weight in the midsection.
Yes.
It's the weight.
They state that when your belly is certain.
Yep.
That's hormonal weight.
That's hormonal weight. And when that weight sits, that's up close to your heart. So women, one of the number one causes of death is heart disease.
Yes,
Like
it
a
is.
lot of women are experiencing heart attacks.
Yes.
Congestive heart failure.
Yep.
Things are going on with our hearts. I mean, we are moving, we are taking care of so many people, and sometimes we forget just to stop to rest. So there is no shame in it to me. If it's something there, your insurance can approve you and pay for it, get what you need to help you feel better in your body.
Yes.
I feel better. I feel better physically. I feel better emotionally. I dropped about 55 pounds and I try to be mindful to keep it off because I don't have no 7.5 shot to help me maintain. And my problem is sweets. I'd rather have sweets than food.
Oh.
And I think that's part of that, that emotional craving that you have. Just when you start to emotionally spiral, you want a comfort food. My comfort food is let me get a little Debbie cake.
Oh.
Let me get a little cookie. You know what I'm saying? And I think that's what it is. But
mine's is let me get a slice of pizza.
Yours is the pizza. Mine would be pizza too because the bread, Veronica.
Oh.
I want women to hear clearly. There is no shame in needing support.
No.
Whether that support is lifestyle changes, therapy, hormonal support, GLP-1 medication, a bariatric revision.
There you go.
Nutritional guidance, meaning you decided you want to pay for a nutritionist, you want to get a trainer at the gym, you deserve to feel well.
And that is
don't make anybody make you feel shame about that. There is no shame in that. Yep.
No shame whatsoever.
So because your body is changing suddenly, Your confidence shift too. And I will say, when I had the weight on, you're questioning your attractiveness, your femininity.
Oh, yeah.
You are questioning your identity because the person that you once knew before, now it's a whole different person. So you're trying to get used to that. You see yourself when you are in the bathroom, taking a shower, raw and uncut. You like,
Yes.
oh my gosh, I see it and I feel it.
Mhm.
And that emotional part, that's what hurt us the most.
It is. It
Yeah.
is. Because let's not even add menopause to it,
Yeah.
right? Because menopause multiplies it by 1,000.
Yes. Yes.
All right.
Yep.
Just in general,
Yeah.
when we start to gain weight, it makes us feel some type of way.
Yes.
So now we add on the the hormonal imbalance because we don't know what the is going on with our bodies right
Yep.
now. You
Yep.
understand? That just makes everything even spiral a little bit more.
Yeah.
Man, I was researching and I was looking, when you look for one thing on TikTok or Instagram, and now your whole
The social
feed,
media, yes.
boy, your whole feed is just throwing stuff at you. And a lot of women who are going through menopause talk about their weight gain
Yeah.
and how they feel. Like they don't feel okay.
Yeah.
Like they've gotten divorced. You understand? They're no longer with their boyfriends. Like their life changed because of this word called menopause.
Listen, that's real. That's real because you know we had me and my husband had the episode where he talked candidly
Yeah.
about a husband's perspective, and that was one of the things in our marriage. I mean, it was intense for a while, for a minute, because I'm changing and I, it's not my fault.
Mhm.
I'm feeling this. I'm going through this in my body. I don't know what to do about it. It's something new. It's scary as hell.
Very much.
It is very scary going through it. So what are you going to do? I talk to my girlfriend. She's like, I feel the same way. I'm talking to you. Girl, I
Mhm.
got that too.
Yeah.
But it's like,
That doesn't change
it
anything
doesn't
though.
change anything until you sit down and talk to your doctor and your
Exactly.
medical professional.
Yeah.
And until they hear you, and
Mhm.
it's like, okay, how are we going to attack this? All right, LaShonda, let's
Mhm.
look at this medicine. Okay, let's take a look at this. You want to research this? You want to see, what the symptoms are? Because it is very, very real. I've talked to so many older women who have told me that going through a hormonal imbalance will test your marriage,
Oh. Oh.
will test your marriage. And they have had friends of theirs that has gotten a divorce over it. You have to approach it with so much gentleness. I mean, you're hormonal, so anything sets you off. You're crying, you're going through the emotional shifts, and then your partner is looking at you like, what is wrong? It can't be that bad, because they don't know. And if you are not transparent enough to communicate it to them,
Mhm.
they definitely don't know. I was
That's
like,
true.
Wilfred, come on, you got to go to this doctor's appointment with me because I want you to hear it from the doctor that it's medical, it's
Right.
hormonal,
Right.
it's you know what I'm
Right.
saying?
I'm not crazy. Like you
I'm
just
not
gotta
crazy.
understand there's
I'm not
something
making this
happening.
up. I'm not
Yeah.
just being a bee.
Yeah.
Something's wrong. Something's off. And I don't feel right. And that's what I'm going through.
Yeah.
I am very afraid. And some of the fear can just make you sit in it
Mhm.
and pity yourself.
I'm gonna tell you, you say the word fear, right? And I
Yeah.
know the topic today was about weight gain and the weight of it all, right? Um, but I'm gonna just pivot just a little bit.
Mm-hmm.
The more I learn,
Mm-hmm.
right? Um, I am really afraid
Yeah.
because I know how bad my bipolar episodes can get.
Yeah.
And I know how hard I worked to get away from that, right? And I mean, I feel it. I'm like, these days, I feel things happen,
Mm-hmm.
and I'm like, you know my line. I'm a G. I, what? But I actually feel myself wanting to cry a
Yeah.
lot more often. Even sitting here right now, I
Yes.
feel like I want to cry.
Yes.
And it's like, how bad? I am terrified.
Yeah.
How bad is it going to get for me? Like me, and my doctors, I do more blood work tomorrow,
Mm-hmm.
right? And because we're trying to pinpoint exactly how we're going to tackle everything right now.
Right.
And I'm like, Veronica, just stay strong. Try to remember, don't feed into it.
Yeah.
Like, but LaShonda, I'm scared because I feel like it's just gonna hit me like a. I'm sorry. Sorry. Oh God. I'm sorry.
But that's
That's how I
the
really
fear
feel.
talking.
I'm sorry. Yes.
That's the fear talking. Okay, so this is what we're gonna do. We're talking about the weight of it all.
Yeah.
For thee,
So,
fear is weight.
yeah.
Fear is weight. So you have a legitimate reason to talk about it, to feel what you feel.
Right.
Because anything medically that's going on with you, that's scary.
Yeah. It is. It is. And then especially when you don't know.
And I'm a whole hypochondriac. You know.
I know. I know.
Listen, I had to pull myself up out of WebMD. Like, I know I'm Dr. LaShonda Bailey, but
Yeah.
I was on there like I was a medical student.
Oh God.
Yes, and that is scary. I think that's why so many women, what you talking about, it's like,
Hey.
I'm not even going to the doctor. I don't even want to listen.
And-
Hot
and
flash, I'm
that's-
going to go.
and
That's what it is.
You understand? And then
That's
a
what
lot
it
of them don't want to go, so they don't even realize that's what they're going through. And then I
Yes.
feel for them as well.
Yes.
Because I want to say, hey, don't you think like you might be? But like you said, it's a taboo word.
Yep.
Women don't want to talk about it. They don't want to approach it, and they don't want to realize that this is real. It's happening.
Yeah, but then the older women,
Right.
they didn't go get treatment.
No.
They
thugged
like
it
you
out.
said, they thugged it out.
Right.
I'm not a thug.
No, me either.
I'm not a thug, and I'm not a superhero.
Mm-mm.
I need medication, and you're talking about fear. Fear is weight. I understand that because my fear was my sister passed away
Right.
with endometrial cancer. I read one article. Oh no, cancer? I don't care if it was skin cancer. I was like, I'm not doing no hormone replacement therapy.
Right.
But then when your body's out of control, you heavy, you don't feel good, you fatigue, you mean, you are like a raging lunatic.
Mm-hmm. You might end up alone. So you're like, you know what? That's scarier than anything else.
That's scary too.
Let me go do what I need to do.
Exactly. But then you are so enraged and you are so unbalanced that you're even telling yourself, I want to be alone.
Yes.
So I don't care if this burned down to the ground.
Right. But then after, when you are alone, what's going on?
You're like, where my family, please?
Exactly.
Where my
I'm
man-
sorry.
Where my man at?
I thank God every day that my husband is such a
Yes.
patient individual.
Yes.
I mean, it took him some time to get there, but he got there. And he is very patient and he understands things. Like, he doesn't jump. Like, he's very, sometimes I feel.
he's gentle.
Yes, he
Because
is
ain't
gentle.
nothing wrong with being gentle.
At all. Okay, babes, I love you.
Yes. Yes. But I understand, Veronica. I am here for you.
Thank you.
This
That
is
time for
why
you.
Beating Heart Health for Women is here. This is why MenoTheSis is here. We're going to release that weight.
That's right.
We are
That's
going to
right.
release that weight. We are going to get to the point where, as close as we are, that's how close we're going to be to our doctors.
That's
like,
right.
you call your doctor by his first name.
Yeah. Me and him
That's
real
how
close.
close you.
I send him
That's
text
what I'm saying.
messages on portal.
That's what I'm
And when
saying.
he takes too long to respond, I call the office.
That's exactly. That's what I'm saying. I need help.
I sent Drew a message 2 days ago and I didn't get a response. I'm coming in.
Drew, because I'm about to lose it.
Oh God, it's so bad. When my children go, like my daughter went to go see him yesterday.
Mm-hmm.
And she was like, she walked in and he said, oh, that's Veronica's face. He said, yes. And yeah, you are your mom. You talk like her too.
Yeah, tell her I'm going to call her back. Tell her I'm calling her back.
And then hear me. damn it, I forgot you was going to see Drew because I needed you to tell him to send me something. I was like,
You know
oh my
what?
God.
But that's how we need to be with our doctor.
Yeah.
Listen, ladies, you are not broken.
No.
We are becoming
Yes.
these women that we were meant to be in this
Mhm.
part of our life. And it is not women suffering in silence, riddled with anxiety, going through emotional waves.
Right.
That ain't it.
Mm-hmm.
So I will say to you, release the weight, whether it's the fear of going to the doctor, the fear of being on medication, the fear of my doctor may not understand this, just the fear of I may go to the doctor for one thing and they might find another. You know what I'm saying? Because that is real.
The fear of getting older,
The
too.
fear of getting older.
Yeah.
We got to
Don't be afraid of that. Listen,
Yeah.
because like we said, we've learned that menopause can start as early as your 30s.
Yes.
You understand? And 30 is 30 young. You
Yeah.
understand?
Yeah.
I'm 42. I'm young.
Yes. I'm
And-
53. I'm young. And we look good.
All right now.
Yes.
He's
And
called
I
up
want to
fine.
feel good. I want to feel good.
That's
You know
right.
what I'm saying? I don't want to
Yes.
just look good. And I want
Yes.
to feel good in my body. So
Yes,
I'm
it's
telling
nothing
you,
wrong.
ladies,
It's nothing wrong.
nothing wrong with it.
Mm-hmm.
We are here for you. Thank you for joining us this evening. I know we got a little rambunctious, but this is so dear to
We
us.
said it was real life, right?
This is
real
real
stories,
life,
real
real
women.
This is it. But thank you for staying with us.
Yes,
thank you
please.
for
Thank
rocking
you.
with MenoTheSis. Happy hormones, ladies. Hey, girls. Hey.
MenoTheSis.
If today's episode spoke to you, encouraged you, or helped you feel a little less alone, we invite you to subscribe, follow, and share MenoTheSis with other women who may need this conversation. And don't forget to leave us a review because every review helps us continue building this movement and reaching more women around the world.
And make sure you stay connected with us on all social media at MenoTheSis and Beating Heart Health for Women. Remember, ladies, your pause is powerful.
We'll see you next time on MenoTheSis.